So today is the second day of October 2025, and Dr. Ken Barter is going to give us a presentation of his report straight to the point.
Thank you. Good morning. Greetings from the traditional territory of the Coast Salish peoples, the Esquimalt and the Songhees nations, all the way on Vancouver Island. I would like to begin by saying thank you for the privilege and the opportunity to contribute to the inquiry and this important work. Like many of you, I watched the ceremony that took place in Ottawa on the Truth and Reconciliation Day, Tuesday of this week. I found it very powerful. As I listened to the speeches and the songs, I was thinking about how I could best prepare for my presentation this morning. One of the Indigenous speakers said, "You cannot have reconciliation without first having and knowing the truth." To me, those words said something about my report, entitled Straight to the Point. In the report, I bring forward some very pointed questions about the relationship between Indigenous peoples of Canada and their federal, provincial, territorial governments, especially when it comes to the health, well-being, and protection of children and youth. My questions have to do with trust, with respect, caring, confidence, and responsibility on the part of both parties to do what is in the best interest of children and youth. A trusting, respectful relationship is critical. I say this based on the belief that if changes are required, and I believe there are many changes required, to bring about good outcomes for vulnerable children, youth, families, and their communities, these changes have to be the result of relationships. Like reconciliation, relationship is not a feeling. It's an action. It means taking responsibility to work individually and collectively to bring about much needed change and a willingness, most importantly, a willingness to do things differently. In terms of child welfare services in Newfoundland and Labrador, to both Indigenous and non-Indigenous children and youth, we have learned over and over again, year after year, decade after decade, that better outcomes for children and youth are not necessarily achieved by changing legislation or creating new policy manuals or having working protocols in place or changing names of government departments or changing ministers or, for that matter, changing governments. We also know that better outcomes are not necessarily achieved by having organizational reviews, task force reports, death and critical injury inquiries, investigations into child maltreatment, and other forms of publications. As pointed out in my report, Newfoundlanders and Labradorians have experienced many of the changes, seen the many reports with their numerous recommendations to make things better or try and fix things. Yet, outcomes continue to remain unacceptable. My report provides examples that have taken place in Newfoundland and Labrador. Changes such as the legislative changes, the 1994 Act respecting the welfare of children being replaced by the 1964 Child Welfare Act, which was replaced by the 1972 Child Welfare Act, which was replaced by the 2000 Child, Youth, and Family Services Act, which was replaced by the 2011 Children and Youth Care Protection Act, and which was replaced by the 2019 Child, Youth, and Families Act. That's the legislative changes. Organizational changes that have been responsible for child welfare services, from the Department of Health and Welfare under the Commission government to the Department of Public Welfare under the Newfoundland government. Also in 1974, the Department of Public Welfare was renamed the Department of Social Services, further renamed the Department of Human Resources and Employment in 1997, and renamed again a year later as the Department of Health and Community Services. In that same year, 1998, the Department of Health and Community Services, with the support of the Newfoundland government, delegated responsibility for child welfare to the Regional Health and Community Services Board. In 2005, these boards became a part and accountable to the 4 integrated health authorities, and child welfare services became a part of this integration. In 2009, the Department of Child, Youth, and Family Services was established following the Turner death inquiry in 2006. Many people would say that's not the reason it happened, but in my view and in my opinion, that change came about solely as a result of the Turner inquiry. Following the Turner inquiry in 2006, the decision was made to remove responsibility for child welfare from the regional integrated health authorities back to a line government department, namely the Department of Child, Youth, and Family Services. In 2006, the Department of Child, Youth, and Family Services was renamed the Department of Children, Seniors, and Social Development. Again, many changes in terms of organizational reviews, all with the intent to try and make things better. And in addition to the legislative changes, which were extensive, the organizational changes, which were extensive, there have been changes in who delivered child welfare services. Newfoundlanders and Labradorians have seen these services carried out by the Newfoundland Rangers way back, later replaced by relieving officers. I was one of those relieving officers hired in 1965 by the Department of Public Welfare. Relieving officers were later changed to welfare officers, which was later changed to social service workers. And then now it's changed to professionally educated and registered social workers. The impetus for many of these changes came from the numerous reports and investigations completed over the years, ranging from the Hughes Inquiry in 1991, the Turner Review and Investigation in 2006, the 25 investigative reports completed by the Child and Youth Advocates Office since 2006, and others that were outlined in Appendix D of the report. A total of 42 reports within the province alone since 1991, with a substantial number of recommendations for improvement, for change, and trying to make things better. And in addition to these reports within the province, there have been many other reports that have been submitted by the Child Welfare League of Canada, by the First Nations Child and Family Services, by the Canadian Incident Study on Child Maltreatment, the Truth and Reconciliation, the study on Aboriginal people. There have been many, many others, all in relation to child welfare services to Indigenous peoples, children and youth. Despite all of these changes, despite all of the reports, despite all of the recommendations, outcomes for children and youth remain an ongoing concern. And these concerns over the years have centered around the staffing crisis that I understand currently exists within Newfoundland and Labrador, recruiting and retaining people to work in child welfare. It is a highly bureaucratized, hierarchical child welfare system with rigid policies and procedures. Resources have constantly been an issue. I remember, and I lived in Newfoundland at that time, working at Memorial University, when the Child, Youth and Family Services Act 2000 was introduced. The MLA, Sheila Osborne, her name was, said in the House of Assembly, "It is a good piece of legislation, but is not worth the paper is written on if it is not resourced." And we have found over the years that the resources never came. And as I was writing the report, I was thinking the resources never came. The minister's advisory report was very clear on that. It was very clear that we found in doing, I was a part of that advisory committee, we found frustrated judges, lawyers, social workers, foster parents, police officers, all saying it is a great piece of legislation, but we need the resources to be able to implement and fulfill its intent. But it never came. But what did come was replacing the Child, Youth and Family Services Act with the Child, Youth Care and Protection Act. And in my mind, I'm wondering, was that change made simply to fit the legislation into the resources that the government had, as opposed to the resources that the government should have provided in order to fulfill the Child, Youth and Family Services Act? That was a little deviation from my presentation. So insufficient resources have been a constant issue brought forward. If one reads the reports prepared by the Child and Youth Advocates Office, they use the term challenges to service provision, was the term used in several of those reports, meaning these challenges were not having sufficient resources, both human and fiscal resources, to carry out the work that needed to be done. We also know the ongoing concern over the years about the lack of investments in early prevention and early outreach, primary prevention. We also know, with respect to child welfare, that many of the root causes of why risk factors exist for children, youth, and families, such as poor housing, poverty, addictions issues, mental health issues, these causes are being skirted in many instances. You will see in the report, a report that was prepared for the premiers several years back. And one of the issues within that report that the premiers across the country made a commitment to is that if we're going to do anything with respect to child welfare, we have to address the root causes. But these root causes continue to be skirted. The over-concentration that currently exists on risk assessment and risk management, and this is all done after maltreatment has occurred, where the emphasis should be to try and prevent maltreatment from occurring in the first place. There tends to be a big concern about the emphasis on parent blaming. And yet parents are struggling with issues totally beyond their control, such as the root causes. The child welfare system, or a child welfare system that currently exists in Newfoundland and Labrador, which is referral-based, primarily, involuntary, reactive, investigative, it's child-centered, and it's also very adversarial. And the list goes on, as you can see in the report. Given that these concerns continue to exist, would strongly suggest that better outcomes for vulnerable children, youth, and their families does not come from building bureaucracies or building policy manuals. I think my report provides sufficient evidence to support that suggestion. Also, seeing these many changes that have taken place and still having concerns in terms of outcomes for children and youth does little by way of developing or having trust and confidence. There's also evidence in the report to support the literature in saying when a system fundamentally fails over many years to meet the needs of Indigenous children, you don't try to make it culturally appropriate. You build a new system. And there's been a great deal of emphasis over the years in trying to make it culturally appropriate. So the critical question that I put forward in my report is there trust and confidence on the part of parents and families who require or need protective intervention services, on the part of those providing the services, and on the part of the Newfoundland and Labrador public in general, that the government of Newfoundland and Labrador will make the necessary investments and changes to ensure better outcomes for the health, well-being, and protection of children and youth. Is there trust and confidence? A question, hopefully, that will be asked during the inquiry. In other words, is there trust and confidence on the part of all to look at building a new system? For the Indigenous people of Newfoundland and Labrador, the question of trust and confidence, given their experiences with mainstream child welfare over the decades, is even more critical. My report discusses these experiences, the Indian Act, residential and non-residential schools, the 60s scoop, and the overrepresentation of Indigenous children in the child welfare system. These experiences, combined with being excluded from the terms of union, forced relocation, forced assimilation and integration, oppressive government policies, both federally and provincially, and many broken promises. All of these add additional challenges to establishing trust and confidence. So, what kind of change is required for Innu in order for better outcomes to be achieved for Innu children and youth? And as I say in the report, some advancements have been made to build on and to facilitate change. The Truth and Reconciliation Calls to Action is one. There were 94 calls to action. We know 10 years later, very few have been acted upon, none with relation to child welfare, which were the priority calls to action within the Commission's report. We now have the Federal Act, an act respecting First Nations, Inuit, and Métis children, youth, and families. This act came into effect in 2020. I would assume that this act and its principles are now hopefully being applied within current practices within the province. my review of various documents, policy manuals, the CSSD work plans, the letter to the minister, the mandate letter to the minister, I didn't see any reference to this federal act. But its intent was for the child welfare systems across the country to apply these principles. There have been amendments to the Child, Youth, and Families Act, good amendments, to facilitate change within child welfare services to Indigenous people. These changes have recognized Indigenous children and youth and defined them, Indigenous representatives, also making it possible to delegate responsibility for child welfare to community agencies. So these are some of the changes. So the Children, Youth, and Families Act was one of the first pieces of legislation, really, that concentrated on making things better in terms of services to Indigenous children. And then, of course, you have the touchstones of hope, the principles and the values behind the touchstones of hope were also used in explaining the current inquiry. And of course, as I say in the report, the touchstones of hope is all about creating a new path. One of those touchstones is, in fact, a rock from Newfoundland and Labrador, because I attended Niagara Falls when the touchstones of hope were developed. Then you had the ENU, the CSSD protocol. You had the ENU care approach. You had the ENU healing strategy, the ENU prevention approach. There's been residential and emergency placement resources. There's also the CSSD's commitment to nothing about us, without us approach. And then there's also the connection. So these are some of the advancements that are all made towards bringing about change and to realize better outcomes. In the report, I attempted to chart out suggestions to think about in endeavors to make improvements and achieve better outcomes. And these suggestions are based upon what has happened in the past, what's currently happening presently, and what possibly needs to happen in terms of the future. And I tried to chart that out. That's within the report. And one of the things that I'm really keen on when you talk about considerations for change is we need to begin thinking differently. The thinking that's got us to this point in terms of the issues, the concerns, and so on, the thinking that got us to this point is not the thinking that's going to get us out of it. We have to make some paradigm shifts. For example, isn't it time that we start talking about children's rights as opposed to children's needs? Let's face it, if we don't see children and youth as individuals with rights as outlined by the UN Convention, the rights of Aboriginal peoples, if we don't see them as individuals with rights, will we ever be able to attend to their needs? Protection is a health issue. It's not a parental fault issue. We need to think about protection being more about families and parents, neighborhoods and communities. We need to think about families, children, youth as people in need of assistance. We need to think about that more than about children in need of protection from their parents. They're all struggling. So protection is a health issue. And that's as a health issue, that brings into play the importance of prevention. Health good health. It's concentrate on wellness. Policies concentrate on wellness, not sickness. We need to concentrate on assistance to families as opposed to blaming parents. I've already mentioned the importance of structural issues, the root causes, poverty, racism, discrimination. There's evidence that is still very prevalent and it needs to be addressed. We need to talk about building community capacities, exploring strengths and capabilities, not problems and deficits. We need to talk about collaboration, partnering with parents, real partnering. I've been a part of the child protection system from 1965 to 1995 when I decided to go into academia. That was 30 years. Across this country, I've worked in child protection, including 8 years in the Northwest Territories in an Indigenous community. I forgot my train of thought there. But we need
You were talking about community capacities and
community
systems
capacity.
as opposed to blaming.
Yes, yes. And it's the capacities within the communities that we need to concentrate on and begin to develop. And we don't do that. We don't do that sufficiently. We need, as opposed to what currently exists, having a child-centered focus, we need to move to a family community-centered focus. Certainly, we need to move protection far beyond the four walls of parenting, and we need to include the community of that. Need to include the community. And I was saying before, spending 30 years in the field at various levels. When I decided to move into academia in 1995, I went to Lakehead University, where there's a fair Indigenous population. I reflected on my 30 years many times. And when I look back over those 30 years, I remember being a part of policy meetings, making decisions about services, making decisions on policies, making decisions on legislation. And never once did it appear or come to us as we were doing this to seek out the opinion of the people who are going to be affected mostly by these policies and procedures. Never once did we consult with the parents, get their opinion on the impact, or did they have something to contribute to that? I used to tell my students when teaching child welfare courses, I used to say, close your eyes for a minute and imagine a knock on your door. And you go to that door and there's a person representing a large authority, child protection, someone that has the authority, and you've heard about in the media, you know what authority they have. They can remove and take your child. And that person is there because someone made an allegation that you as a parent are not fulfilling your parenting responsibilities, that there's an alleged maltreatment. Can you imagine how devastating that would be? And I used to say to the students, if there was someone beside that social worker who could look at you and say, I know exactly what you're feeling right now because this happened to me. Who do you think you're going to relate to? I know who I would relate to. It would be the person who can say, I know exactly how you're feeling right now. And the message being, we're here to help. That's building capacity. That's using parents and their skills. And many of them have skills. All of them have skills that can help with this important work. And that's how you build capacities.
Dr.
That's
Barter,
a
do you mind
little
if I
excitement.
ask you a question here?
Not at all. Go ahead.
So just take I'm a sort of a concrete thinker and I like to use examples. So if you have a parent who is drinking to the point that the care of the child is negatively impacted, can you explain the way a community-centered approach or a non a different approach than the one we currently have and the current approach? Like, what would be the current approach now, and what would be the approach that you would like to see in terms of a place which centers a system which centers the family and the community?
The approach that I would like to see, if a child is at risk, the approach that I would like to see is being able to connect with the parent as best as possible, to seek out the resources within the family, the community, to bring together the necessary resources to, in partnership with the parent, to say, how are we going to move forward to resolve this issue? It's a we. How are we going to do it? Now it's resting primarily with CSSD. If there is a protection intervention, particularly in small communities, everybody knows it. Everybody knows it. When I was in the field, I used to hear daycare center workers and kindergarten teachers saying, if something is not done in this situation, something serious is going to happen. But the law, as we currently have it, you got to wait till something happens before we can intervene. Why can't we do the outreach and provide the services and the supports that are necessary? Certainly, at times, apprehension is necessary for the safety of the child and so on and so forth. But that's the last resort, not the first resort. I mean, the most tragic surgery that you can do to a family is to remove children. Is to remove it's tragic. So
And
everything else,
results in poor outcomes.
and it comes, oh yeah, poor outcomes. I mean, we know that the state does not make a very good parent.
So what do you do with that person? You go in and you say to the mother, or say it's a single mother, you go in and you say to the mother, what can we do? And then where does it go from there?
Well, what can we do? What does the mother think that we can do? What does the auntie? What does the grandparents? What does the teacher? What does the recreational people? Like, it's that neighborhood community that can really come forward for that, providing those kinds of support. The parent needs connections. They need assistance. And the kind of assistance that they need cannot really come from someone who has the authority to remove their child. They have to be able to connect with others, similar others, and be able to see that, changes are required. There's going to be supervision, et cetera, supervised. All of these things are necessary for the safety of the child. But the parent also needs those kinds of supports.
So like if it's drinking from trauma, then maybe some trauma counseling.
Well, counseling certainly would help, particularly at a group level, having supports that they can rely on. I would ask the question now, and if I were a parent in a small community, knowing what I know has happened in the past and so on, if I really needed help now, would I go to child protection for that help? voluntarily go and saying, I'm struggling, or last night I had a real bad episode with my child and I need help. That's what the child protection system would like to see, but that's not what's happening in reality. Their child protection is something to be avoided as opposed to something to be embraced. And the challenge is, how do we turn that around so child protection is seen as something to be embraced? That's where you go for help. That's where you go to seek out assistance. That's where you go not to get your child removed from you, but in order to keep the family together. And that image does not exist at this point in time. And that's a lot of work to be able to change that around. But it is possible to do. There are Indigenous communities across this country that are doing exactly that. And I provide
And
some
it is
examples
by offering assistance.
by offering assistance, because it is about families and parents who are struggling and in need of assistance. And so,
And helping to provide that assistance when, say, if you don't have like an auntie who can come in and give you a few hours to yourself if you're a single parent, then would like respite care be part of that if it was available?
it could be a part of that, of course. Having, like I have a great belief in community family resource centers. They're a great resource. If a parent is feeling stressed, somewhere where they can go saying, like, can I have some help for this point in time? Or here's, I'm having this particular issue, like, help me do that. And these family resource centers are very good at doing that. And the main thing is that they have relationships and they can develop those kinds of relationships. And once the relationships are developed, then they can rely on that to help them through difficult times. All parents struggle, for sure.
Yes, thank you.
So during the reconciliation celebrations in Ottawa, the executive director for the Truth and Reconciliation Commission, she stated in her speech that the Truth and Reconciliation Commission's calls to action built the mountain for us to climb and laid out a path on which to do so. I thought that was pretty insightful. It built the mountain and created a path to bring about the change. That's the 94 calls to action. And my hope is, even though it's been 10 years and a lot of work has not been done, that if anybody's going to start engaging in order to bring about change, engaging into that mountain, to follow that path, then hopefully the principle number 9 of the Reconciliations Commission's report, principle number 9, is in place. And that principle is reconciliation requires political will, joint leadership, trust building, accountability and transparency, and a substantial investment of resources. And that's the key. That's the key. That substantial investment of resources have not been in place, both federally and provincially. So in some ways, my hope is that my report can give some support, some assistance in being able to make this climb, to climb this mountain. And hopefully it provides sufficient evidence as to why there needs to be a significant investment in resources, because it's absolutely essential. I say in my report that Newfoundland and Labrador, in terms of bringing about change, we've seen too many false starts. Too many false starts. And I provide a little chart in one of the appendices of the report as to what is required in order for change to occur. And if we don't have all, the vision, the incentives, and the resources, and the action plan, and so on, if all are not in place, then we're likely going to have more anxiety, more frustration, and so on. So we need to be very clear on that. So in my view, reaching the top of the mountain means what is being endorsed in the national and international Indigenous and non-Indigenous literature and research. And that is at the top for the Innu, that is an Innu child welfare system that is built on Innu traditions, values, customs, laws, and also under Innu control and authority. And the research is very clear on that, nationally and internationally, that it is important for self-determination to take its place and for the Indigenous populations to have control over child welfare. And that fits in line with the Innu healing strategy, the vision that they put forth, which is to rebuild healthy, sustainable, and resilient Innu communities. That is a great vision. It is achievable. The skills on the part of the Innu, the leadership, the political will is there. They just need support. They need resources to be able to achieve that. So I wish the best of success in terms of the inquiry, in terms of the Innu to achieve better outcomes for their children and youth. And there's one last thing that I would like to say is that there is a limitation in my report. It would have been a much richer report if, for example, if I had the opportunity to bring the questions that I raised in the report, the issues that I've raised in the report, is to be able to have a dialogue with the Innu people, with the leaders, with the elders, with the parents who have been exposed to child welfare systems, with the workers, with the police, with the community generally, to be able to get their view on what their view would be on the questions that I raised. And I would assume that hopefully the inquiry would be asking those questions.
Thank you, Dr. I do have one more question, if I could.
Just one thing. So the limitation in my report is that it does not have the voice of the Innu or the voice of the stakeholders. So it is primarily a research report with a study of the documents and so on and so forth. But I would have loved to have asked questions within focus groups of elders and parents and so on. Like, is the federal act, for example, being applied in services now? It came into effect in 2020. So are the principles of this act being applied? Can you see it working? Is it there? Yes or no? Is the protocol working? Or do you feel there's trust and confidence to be able to move forward to deal with many of these difficult challenges? Is there trust and confidence? And one really needs to look at that very carefully and be truthful about it. Is there sharing of power in decision making? Are resources continuing as an issue? So hopefully these kinds of questions will be raised in the inquiry for sure. So thank you again for the opportunity. And your question, Lynn?
My question, sir, is the influx of resources that you would need to take it from the kind of system which focuses from the kind of system that we have to the kind of system that you envision, where it's helping and supporting. Would that this system that you would like to see in terms of outcomes, would it require the sustained effort, say, in 20 years? If we had a fully resourced system now, would we be seeing the same kinds of mental health and health issues of the adults that we have in those communities now? Or would there be a path to healing that would go through the next generations?
I would think there would be a path to healing that would go through the next generations. I would think that. I would think that if we move forward on the change, then we have to be very, very critical of ourselves. We have to be accountable to ourselves, and we have to be transparent. So I would ask the question, the advocate's office produced investigative report after investigative report on very serious child maltreatment situations. And within many of their reports, the same recommendations are being made. Even though if you turn the page, you can look at progress on recommendations made. And we're told that of all the recommendations made by the many reports of the advocate's office, that these recommendations have been implemented. But yet, these situations keep occurring and keep occurring. And in the reports themselves, the advocates, I think in one report it says, here we go again. Even though we were told these, but it doesn't seem to translate into practice. One of the big things that we've learned from the youth inquiry is that it's not the responsibility of one department to be concerned about the protection and maltreatment. It's a collective responsibility. And it was supposed, like, the police are supposed to talk to the social workers, who in turn should talk to the police, to the nurse, to the doctor, to the teachers, like that kind of community. And it comes up again and again in report after report. There's been a breakdown in communication. There's been no sharing of information. So, I mean, we need to learn, particularly after things are being repeated, like what's happening here? What's happening here? What's happening that that recruitment and retention of social workers is a big issue? Why is it that people don't want to work in this important field? Why is it? And is it because of the work? I would contend no, it's not because of the work. It's because of the bureaucracies that they're required to work in. The Canadian Association of Social Workers, have filed report after report over the years. And social workers, the morale is low, they don't feel respected, they're into a situation of many ethical dilemmas, they're damned if they do, they're damned if they don't. So who would want to work in a system like that? And I mean, these are well-educated people with, professional ethics. And certainly they need discretion, they need autonomy, they need to be able to take risks when they're dealing with such a complex field. And they need support in doing that. And that's why it needs to be that kind of collective approach. So there are many things that we need to kind of rethink in terms of child welfare. It's a very complex field, and it's connected. It's connected politically, it's connected economically, it's connected socially, and we are treating it now like we intervene in the family only. That's where the concentration is. But the concentration is not only an intervention required in the family; it's an intervention that's required at the community level, at the organizational level, and at the professional services level. I mean, if a child is if there's a protection intervention plan within Nakwashish or Seshishi, then the teacher needs to know what that plan is too, as does the police officer, as does the auntie or the uncle or the grandparent. Like, that collectivity needs to be there. And that child needs to know that they can go to the auntie or the uncle if they require that and get support for doing that. Or the parent needs to know, I can do that too and get support. I won't be condemned if I do. That's a lot of work to bring together community capacities, but it is possible. It
And
is possible.
the trust that you were talking about earlier, does a parent who's in trouble trust that if they go to CSSD, they will get help? Do you think that trust needs to happen between the higher ups in the bureaucracy and the frontline social workers? That the social workers need to trust their hierarchy, and the hierarchy needs to trust the social workers?
Indeed,
Yeah.
indeed. Anyone working on the field, particularly in a field this with this complexity, you need to know that your organization has your back, and you need to feel that confidence and that kind of trust. I'm not sure I would need to have focus groups with social workers to find out if that exists. And also the bureaucrats, the hierarchical bureaucrats, they also need to be able to trust that their staff are going to be doing things in an ethical manner as well. So that kind of trust needs to be established. Is it there? I don't know. I don't know, but I suspect that if there's a recruitment and retention problem, then yeah, there are issues. There are issues. And
Sure.
certainly, when you read and everything that I've done in terms of this report, I've searched the documents, read the documents, and so on and so forth. But when you read that, one of the reports that the department relied on heavily when they were introducing new changes, bringing in new legislation, was the clinical services review report. And that was mentioned when the new act, the Child and Families Act. There's been so many acts, it's hard to remember all the names, but
Yeah.
that report was mentioned, and I give a preamble in one of the sections of the report about what that report was saying, the clinical services review. And you could see when you read that review, the clinical service, you could see the frustration coming out in the words as to, like, do not let this be just another report.
Right.
Like, what this for the sake of the children, this requires strong leadership. And do you get strong leadership when there's been 4 ministers in 5 years? No,
So
you
that
don't.
clinical services pointed out some serious defects with the way child welfare was administered, and then they decided after that to do less. They took prevention out.
They did. They did. And what they did is they created a legislation to serve the organization, not to serve the parents and the kids and the families and the communities.
And then we all pay for that.
And we all pay for it. We all pay for it. And I mean, child protection work can be a great place. Like, it's sad that they are having trouble recruiting and retaining. And in the chart that I provide, we need to make some changes there too. We often say, we need more social workers. Well, I'm sure that we do. We need more social workers. But the follow-up question to that is, we need more social workers to do what?
Right.
And I would recall back in my days in the field where, as a social worker working with a caseload of 35 to 40 families, how much it would have benefited me if I had working with me a youth care worker, a home helper, a homemaker, a team that could work with me to help with helping the families. And I mentioned, and I don't think, as I said before, that we've engaged parents enough, and getting their opinion and making them a part of the decision-making process. So you go to a parent, you've had an experience with the child welfare system. Can you tell us about this experience? In your view, what would you think might have helped, been a little bit more beneficial to you? What suggestions would you have for someone else? That kind of input is not being sought out.
Yeah.
It's not being sought out at all, and it needs to be. And of course, the first thing that you would get from the child welfare system, like saying, well, people need to know, particularly in small communities, but in neighborhoods as well. Teachers, like, people need to know that. And the first thing that they would say is, well, it's confidentiality. Well, I don't want to downgrade confidentiality. It's very, very important. But when it comes to the development and the health of a child, then I'm sure that most parents, I would probably go and say all parents want the best for their child. So they would certainly sign consent to anything that's going to benefit their child. And it's that inclusion. I remember being a regional director of the largest agency in Prince Edward Island, and remember a foster parent came into my office. She went through the worker, the supervisor, and finally got an appointment with me because she was so angry. Not a foster parent, a biological mom whose child was in care. And she was so angry at the social worker, the foster parents, and so on and so forth. And she was very angry at me as well for allowing this to happen. And we talked. And we talked. What she was angry about is not what happened, like her daughter being outfitted with new clothes, a new bike, knew this, knew that. Everything was great. The daughter was so happy. What she was, not that her daughter got that, what she was most angry about is they didn't include her to be a part of that experience with her daughter. That's what it was. So it's that inclusion. That's very, very important. And we need to reach out. And I mean, there's a lot of capabilities, there's a lot of energy from people who have been involved with the system that could help make the system much better if we give them the opportunity. And that's what social work is about, in my opinion. And that's what frontline child welfare protection is about. It's about creating opportunities for people to discover their power.
Right. I think that's a really good way to end. Thank you, Dr. Barter.
Thank you.